Hello, I'm Dr. Alvin. I'm a nephrologist and a palliative care physician. I became interested in palliative care because I saw some of my dialysis patients suffering and I wasn't sure how to treat them. It sort of got me on a life journey in which I learned more and more about how to integrate palliative care into the practice of nephrology. And now I describe myself and probably dozens of other nephrologists around the country as palliative care nephrologists, much like there would be transplant nephrologists or interventional nephrologists. Supportive care to me means identifying what's most important to patients and then treating them according to their values, preferences, and goals. It's really providing an extra layer of support to patients and to their families. As a younger, early career nephrologist, I wasn't aware of patient-centered care or how I could really talk to patients and learn what's most important to them and treat them according to their wishes. And really becoming more interested in palliative care made me understand the importance in the physician-patient relationship of really talking to patients and learning their values and their goals, what treatments they would want, what treatments they wouldn't want. If I could do one thing to improve physicians' knowledge about how to treat patients with end-stage kidney disease, I would really love for them to fully understand shared decision-making, and especially the importance of a patient estimate of prognosis, and really talking to patients and deciding with patients, including the physician knowledge of the patient's overall condition and how that overall condition plays into a likelihood of how well or how poorly they are likely to do if they start dialysis. Really, so this knowledge of prognosis and incorporating the knowledge of prognosis and then having the communication skills to have a shared decision-making discussion with patients and families would really improve the care of especially older dialysis patients who have multiple other chronic conditions. The typical care that I see, nephrologists are excellent physicians, they take excellent care of their patients, but my concern is that some patients, especially older patients, those with multiple comorbidities, may suffer a great deal while they're on dialysis, and many of them didn't even know that they had an option other than going on dialysis. Many research studies have indicated that patients didn't realize that they had a choice and that there was something called active medical management without dialysis, especially for your elderly patients who really have a little bit of cognitive impairment or significant functional decline, that they could have chosen another pathway for treatment of their chronic kidney disease. And many patients who pursue an active medical management without dialysis course may live for a year or longer and not have the inconvenience of going for dialysis treatments 3 times a week and really value the independence that that lifestyle gives to them.